Thank you, Senator Rennick.
Okay. Hi, guys. Look, this morning I asked about the deaths in 2021. I've asked this question numerous times. I've been given a study that has somehow tried to refute that. I looked at the study. The study related to deaths in 2022. So 2022 was completely different in character to 2021 because in 2022 COVID was in the community. So I don't know why you gave me a study relating to an entirely separate year, different year to 2021. So I'll leave that as a comment. But I do want to refer to a comment that a media release that was put out by the Department of Health and Aged Care about the Office of Gene Technology Regulator addressing misinformation on the regulation of mRNA vaccines. And effectively, that's this one. You were saying that the TGA is responsible for assessing all COVID-19 vaccines before they can be used in Australia. The TGA rigorously assesses any COVID-19 vaccine for safety, quality and effectiveness. How can you say that, especially in regards to genotoxicity, when in your own product assessment report, page 31 for the Pfizer vaccine, you've noted that you've got missing information, use in pregnancy while breastfeeding, immunocompromised patients, use in frail patients with comorbidities, use in patients with autoimmune or inflammatory disorders, interaction with other vaccines, long-term safety data. And I'll note that the testing was done on a PCR-amplified DNA, and the commercial batches were actually made from linearised plasmids that involved E. coli. And that E. coli, if it's not filtrated, could have got into the batches. So how can you possibly say, and I don't care whether it's the OTGR or yourself, the TGA, that your testing of the vaccine was thorough when you just didn't look at did all that testing I just noted?
So Dr. Kerr is just coming to the table, and we might just, sorry, you're asking questions of a number of different groups there, Senator, so I think it might be worthwhile to just get Dr. Buller from the Office of the Gene Technology Regulator up as well. It may be, however, Senator, that there are some particularly technical elements, the questions that you've asked, so it may be that after this we may be in a position that we need to...
I don't want to overcomplicate the answer. I mean, there was a raft of testing that wasn't done. So you can't say it was thoroughly tested if you didn't do all that testing.
You know, I take your point entirely, Senator. I don't want to overcomplicate the answer either. We had a back and forth last time, and it ended up being about an enzyme that we didn't actually, that wasn't actually a real enzyme. So what I want to really be in the situation of is to be able to understand your question very clearly, give you a very clear answer, because I know that we've had these conversations previously. But before we do, just on the testing issue, I might ask Dr. Kerr to comment, and then maybe Dr. Buller on the issues that you raised around the OGTR.
Thank you, Tony. Lisa Kerr, Acting First Assistant Secretary, Medical Devices and Product Quality Division. I think your question is about the linearised plasmid, that the end product, the mRNA product, is not different between the two processes.
It's noted in your own product assessment report. Sorry, it's in the non-clinical report, page 19, that you have actually noted that you've used two separate methods. So the process is the product, right? So I'll go to page 19.
No, that's not correct, actually, Senator Rennick.
Commercial scale manufacturing process includes use of linearised plasmid DNA template for mRNA production, whereas in early development phases PCR-amplified DNA template was used. So
yes,
two different processes, two different risks.
That is correct, but the end product, the mRNA product, is the same.
But a different process was used that introduced the risk of E. coli ending up in the batches if it's not filtrated properly.
So the product is actually filtrated quite effectively, and we do actually look to make sure that the company is doing that properly. We evaluate the filtration and purification steps during the evaluation process, and then we check them in the batch release process after they have been released in Australia. That has been done for every single batch released in Australia.
So if that's the case and it was done properly, why did you use different testing mechanisms for the DNA that used fluorescence testing and the mRNA that actually used qPCR testing? So one overstated the DNA, one understated DNA and one overstated mRNA.
Are you referring to the Pfizer production process? Or are you
I'm referring to the testing, so FOI 33090-11. So that actually gave the results of a particular batch, and I'll note that batch had 67 particles that was greater than 10 microns. So that's bigger than the size of a virus, much bigger than the size of a virus, more likely to be DNA or a
But
bacterial.
within the allowed specifications for a pharmaceutical product. So
Sorry?
it passed the tests applied to it. That is the passing result.
It passed the test for naked DNA. It didn't pass the test for encapsulated DNA.
The
Is that
test is
correct?
for total DNA, and
Chair,
it passed the test.
I feel that we're moving a little bit into a kind of a rolling debate, and I think Dr. Kerr should get more of an opportunity to answer the questions rather than just a staccato. I think it's a bit difficult for.
Are you trying to deflect here?
No.
Senator Rennick, Mr. Comey
Those questions were all
is
entirely valid, Chair.
making point of order. No, I don't believe that's a point of order he's making. Senator Rennick, as you know, it's hard for me to follow as chair if I can't hear all the answers, and also your fulsome questions. So if we could provide a bit of space for that, please. Dr. Kerr.
Thank you. I'll also note that we've answered these questions multiple times in previous questions on notice. So I stand by what we've said before multiple times.
That's fine, but I'm asking you now.
Senator Rennick.
Okay, as a question. Okay, inadequate, but let's take it as it is.
Professor. Sorry, Senator Rennick. Professor has the call.
No, I note that you said inadequate, and I take that, but that this question was itself discussed at the last Senate appearance, and we've answered that with SQ 2302-047 and SQ 23002051.
And the reason why I'm asking again, it was that I wasn't happy with the answer, which is my prerogative as a senator to do. Okay, because more and more results are coming out that's showing that they're finding DNA in the actual batches.
Senator Rennick, at this point, the officials have answered the question. I
Chair,
appreciate your
I'm explaining why, because
dissatisfaction
there's more
with the
evidence
answer, but
coming out. That's all.
they've answered the question to their best of their ability, and that is their obligation, I believe, as Chair it's met. I think it's useful to move on so that we can enable both you and Senator Roberts to get to your next question.
Authorised G. Rennick People First Chermside.